Your dog gets stuck in a corner, stares at a wall, or suddenly hesitates at a door they've used for years. Most people call that getting older. They're wrong. That's often early cognitive decline, and it usually goes unnoticed for months. In a second, I'll show you what to do. First, you need to recognize the signs most people miss. This condition is called canine cognitive dysfunction. By age 11, studies estimate over 60% of dogs show at least one sign of cognitive decline. Vets often track it using a simple framework: disorientation, interaction changes, sleep disruption, house soiling, activity shifts. You don't need to memorize that, but you do need to recognize how it shows up in real life. Sign 1, easy to dismiss. Your dog walks into a room and pauses, not sniffing, not resting, just stuck. They hesitate at doorways, get caught in corners. You'll probably laugh the first time. Most people do. Sign 2, something feels off. They start staring at nothing, fully awake, no response to movement or sound. Ask yourself this: how long do they stay like that? If it's more than a few seconds, that's not normal distraction. Sign 3, your routine starts breaking. Now it affects your life. They sleep all day, then pace at night, circling, wandering, sometimes vocalizing. 2 a.m. becomes normal. This isn't restlessness. It's a disrupted sleep-wake cycle. Sign 4, training unravels. This is where doubt disappears. A dog that's been house-trained for years has accidents. Commands they've known forever don't register. You give the cue, they look at you, but nothing connects. That gap, that's cognitive failure. Sign 5, identity shift, hard escalation. This is the one most people aren't ready for. Your dog stops meeting you at the door, or follows you constantly like they're unsure you'll come back. They hesitate around familiar people, sometimes even in familiar spaces. It's not just behavior anymore. It's recognition starting to slip. If you've seen 2 or more of these, don't wait. 1. Rule out other causes first. These symptoms overlap with pain, vision loss, hearing decline, neurological disease. You need a vet to separate those. 2. Bring proof, not guesses. Film short clips, staring episodes, pacing at night, confusion at doors. This compresses weeks of behavior into something your vet can actually assess. 3. Start cognitive support early. There are clinically studied options like Senilife and Activate. They don't reverse the condition, but earlier use is associated with slower decline. 4. Reduce cognitive load at home. Confusion worsens in unstable environments. Make things predictable. Fixed furniture layout, consistent routines, soft lighting at night, supportive, easy-to-find resting areas. You're not fixing the brain. You're reducing how hard it has to work. This doesn't disappear. It progresses quietly, then all at once. And the hardest part isn't the accidents or the pacing. It's the moment your dog hesitates, like they almost recognize something, but can't quite place it. Catching it early doesn't stop it, but it delays that moment. If you have an aging dog or cat, these changes are predictable, not random. Subscribe to Senior Pet Care for clear, practical guidance on managing health, behavior, and cognitive decline in senior pets.